Good morning, Mr. Lai. How are you feeling today?
早安，医生。我今天很好，你呢？
I'm also doing well. Thank you for asking. So, we're here today to discuss your upcoming colonoscopy. A colonoscopy is a procedure that allows us to visualize the inside of your colon and rectum using a flexible tube called a colonoscope. The colonoscope has a light and a camera at its tip, which will allow us to identify any abnormalities, such as polyps, inflammation, or signs of cancer. Have you heard of this procedure before?
听说过，但不太清楚检查的具体过程。
That's okay. I'll explain everything. The colonoscope is inserted through the anus and advanced into the rectum and colon. Once in place, we will carefully inspect the lining of your colon. We can also take biopsies if needed, or remove polyps. Polyps are growths that develop on the inner lining of the colon. They are usually benign, but some can develop into colorectal cancer over time if left untreated.
我会不会感觉到痛或者不舒服？还有，什么是活检？
Most patients don't feel significant pain, but you might experience mild discomfort or cramping as we inflate the colon with air. This helps us get a clear view of the colon's lining. You'll be given a sedative through an IV to help you relax and feel comfortable during the procedure. Some people may also receive analgesics to manage any pain. To answer your question about biopsy, it means a small sample of tissue is taken from the body to examine it under a microscope for signs of disease.
过程需要多长时间？
Typically, a colonoscopy lasts about 20 to 30 minutes. Afterward, we'll monitor you for a short period as you recover from the sedation. Most patients are able to go home the same day.
这个检查可不可以选择全身麻醉？
Typically, we don't use general anesthesia for this kind of procedure.
做肠镜检查之前需要做哪些准备？
Preparation is key. You'll need to cleanse your colon thoroughly so we can get a clear view. This is done by drinking a bowel preparation solution the night before the procedure. This solution causes diarrhea, which empties your intestines. You'll also be on a clear liquid diet 24 hours before the procedure, which includes broths, tea, water, and certain juices.
可以喝咖啡吗？我每天早上都要喝咖啡。
The meaning of clear liquid is that if you pour the liquid into a glass, you can see what's inside the glass. Coffee and milk are not considered as clear liquids.
如果我不按照准备的指示做，会怎么样？
If your colon is not adequately prepared, it can interfere with the procedure. Incomplete cleansing can lead to a poor visualization of the colon, and we might not be able to detect polyps or other issues. In some cases, we might need to reschedule the colonoscopy.
还有什么是我需要知道的？
Make sure to arrange for someone to drive you home after the procedure, since the sedation can affect your ability to drive. You may also experience bloating or mild cramping after the procedure, but these symptoms should go away within a few hours. It's important to let us know if you experience heavy bleeding, fever, or severe pain, as these could indicate complications.
结果什么时候会知道？
we'll discuss the results with you after the procedure. If we find something that needs further testing, we'll schedule a follow-up appointment. If no issues are found, you can usually continue with your regular activities.
谢谢医生的解释，我现在明白了。
You're welcome, Mr. Lai. We'll take excellent care of you. Do you have any other questions?
是不是现在预约时间？
Someone will call you to schedule the appointment.
好，谢谢。
Great. We'll see you on the day of your colonoscopy.